Have you ever noticed how few people talk about constipation out loud, even among close friends? We tend to keep it to ourselves, yet, for many Americans over 65, it's a daily frustration. Here's the good news. Most constipation isn't just aging, it's your body asking for better support, and a few simple food shifts can make a big difference within days to day. We'll cover 5 foods that naturally get things moving. You'll also get a 7-day reset plan, a bathroom routine that actually works, and a checklist to spot red flags, if practical. Natural fixes are your style. Please tap subscribe and the bell so you don't miss new videos made for life after 60. Let's start with a quick reset of what normal really means. Normal isn't a number, it's comfort and consistency. Some people go 3 times a day, some go 3 times a week if you're straining, passing hard pellets, or feeling like you didn't finish. That's constipation, even if you go daily aiming for soft, smooth, easy-to-pass stools is the goal. Why does constipation show up more after 65? A few common reasons add up. Thirst signals fade. So we drink less. We tend to move less, so the colon moves less. Medications can slow gut motility. Diet often shifts toward lower fiber, especially if chewing is hard or appetite is low. Pelvic floor muscles can weaken or tighten with age. The solution isn't harsh laxatives, it's smart, gentle habits that help your system work the way it's designed. Before we dive into the 5 foods, 2 important pointers. Increase fiber slowly. Add about 5 grams per day each week until you hit your target. Drink more fluid as you add fiber. Fiber without water can backfire. All right, let's get to the foods. These aren't trends, they are time-tested, easy to find, and they work. Prunes, also called dried plums. They've earned their reputation for a reason. Prunes bring 2 gifts: fiber and sorbitol. Fiber bulks and softens stools, or bitol draws water into the colon gently. Like a natural softener, together they help you go without cramping or urgency. How to use them. Start with 3 to 4 prunes a day with a glass of water if you're petite or sensitive. Start with 2. You can eat them as a snack, chop them into oatmeal, or blend them into a smoothie. Prefer a drink. Try 4 to 8 ounces of warm prune juice in the morning and see how you feel. Tip: if you're on a low potassium plan for kidney disease, or you're sensitive to sorbitol, talk to your clinician before making prunes a daily habit. A quick story. Henry, 72, felt bloated and stuck for years. He tried powders, teas, and even prescription meds. Nothing lasted. He added 4 prunes at breakfast and 2 more in the afternoon. For a week, results: easier mornings, less bloating, no more strain. He kept the habit because it worked without side effects. Chia seeds, tiny seeds with huge benefits. Chia holds water up to 10 to 12 times its weight, forming a smooth gel. That gel adds moisture and bulk, which helps stools move comfortably. How to use them. Soak 1 tablespoon of chia in at least half a cup of liquid for 10 to 15 minutes. Stir into yogurt, overnight oats, or a smoothie. Work up to 2 tablespoons daily if you tolerate it well. Always soak or mix well. Never swallow dry chia. It can clump and be uncomfortable. Bonus: chia brings plant omega-3 south and minerals like magnesium and calcium. Great for heart and bone health after 60. If you're on a blood thinner, chia's omega-3 south are food level. But always tell your clinician when you add regular daily amounts of any new food. Oats, the gentle fiber that keeps things moving. Oats are rich in beta-glucan, a soluble fiber that forms a soft gel in your gut. It softens stools and supports heart health by helping lower LDL cholesterol. Oats are easy on sensitive digestion and act as a prebiotic to feed your good gut bacteria. How to use them. Half a cup of dry, old-fashioned oats at breakfast is a great start. Make them warm with cinnamon and berries. Soak them overnight in milk or a non-dairy option with chia. If you're gluten-sensitive or have celiac disease, choose certified gluten-free oats. Oats won't cause the cramping some high-fiber foods do. That's why they're a perfect first step. Fiber sweet potatoes, delicious, nourishing, and naturally hydrating. A medium sweet potato with the skin has around 4 grams of fiber. With a balance of insoluble and soluble types, insoluble fiber is like a broom. It adds bulk and helps move things along. Soluble fiber feeds healthy gut bacteria. To use them, roast wedges with olive oil and rosemary mash with a little cinnamon. Add cubes to soups or stews. Cook, cool, and reheat for more resistant starch, which your gut bacteria love. If you're on a potassium-restricted plan, check with your clinician about portion size. Kefir, the fermented drink that helps restore rhythm. Kefir is rich in probiotics, beneficial bacteria that support digestion, reduce gas, and help regulate bowel habits. When your gut community is balanced, things move more predictably. How to use it. Start with half a cup of plain, unsweetened kefir daily, ideally in the morning, or with a snack work up to a cup if you like. Blend it with berries and a spoon of chia for a creamy, probiotic-rich smoothie. If dairy bothers you, look for lactose-free or non-dairy kefir made from coconut or almond milk. Choose pasteurized products for safety. If you're immunocompromised, stick with store-bought and talk to your clinician before using homemade ferments. Quick recap of the 5. Prunes for fiber and sorbitolcha for moisture, and bulk oats for gentle gel fiber and a happy microbiome. Sweet potatoes for balanced fiber and hydration. Kefir for probiotics that support regularity. Use all 5. Mix and match the simple, consistent habits that when want a few recipes you can make without cooking skills. Here are 3 that work fast. Rescue breakfast bowl. Half a cup of cooked oatmeal. 1 tablespoon soaked chia. 3 chopped prunes. A handful of blueberries. Splash of kefir or milk. Sprinkle of cinnamon. A glass of water on the side. This combo delivers soluble fiber, moisture, sorbitol, and probiotics in 1 bowl. Evening sweet potato plate. Roasted sweet potato halves with olive oil and rosemary. Side of steamed greens. A drizzle of tahini or a spoon of pumpkin seeds for extra magnesium. Herbal tea or water. Gentle, satisfying, and gut-friendly morning move smoothie. 1 cup kefir. 1 tablespoon soaked chia. 2 pitted prunes. Half a banana. Half a cup frozen berries. Blend with water to desired thickness. Sip slowly. Follow with a 5-minute walk for best results. How much fiber should you aim for? General targets after 50 are about 30 grams per day for men and about 21 grams per day for women. Most Americans get half that. That's why easing in is important. Add 5 grams per day each week and notice how you feel. Hydration. Mix fiber work as you raise fiber. Raise fluids. A simple rule. Have a full glass of water with breakfast, lunch, and dinner, plus 1 between meals. Warm fluids can be especially helpful in the morning. If your clinician limits your fluids, Follow that guidance now. Let's talk about the bathroom routine that actually works. Your colon has a built-in rhythm. It's most active after you wake and after meals. You can use that to your advantage every morning. Follow this simple sequence. Drink a warm beverage, coffee or tea can help. Caffeine stimulates the colon. For many people, eat a fiber-rich breakfast like the rescue bowl above within 20 to 30 minutes. Go sit on the toilet. Even if you don't feel a strong urge, place your feet on a small stool so your knees are slightly above your hips. This squatty position straightens the rectum and reduces straining. Lean forward slightly. Rest your elbows on your thighs and relax your belly. Breathe in through the nose and out through the mouth slowly. Do not hold your breath. Give it 5 minutes without pushing hard. If nothing happens, get up and take a short walk. Try again after lunch. Training the habit beats forcing the moment. Gentle movement is powerful. A 10 to 20-minute walk after breakfast or dinner nudges your colon to move. So does light core engagement. March in place. Do a few seated knee lifts. Try a simple clockwise belly massage with your palm to follow the path of the colon. Small regular movement beats occasional big workouts for your gut. Let's layer in a 7-day gentle reset using the 5 foods. No drastic changes, just steady, doable steps. Day 1. Add 3 prunes with a glass of water mid-morning. Walk 10 minutes after lunch. Sit on the toilet 20 minutes after breakfast. Day 2. Repeat. Day 1. Add 1 tablespoon soaked chia to breakfast. Drink a warm beverage with breakfast. Day 3. Make the rescue breakfast bowl. Walk 15 minutes after dinner. Do a gentle 5-minute belly massage in the evening. Day 4. Add a roasted sweet potato to lunch or dinner. Place a footstool in the bathroom for the right position. Keep fluids steady through the day. Day 5. Add half to 1 cup of plain kefir. Keep prunes and chia practice relaxed breathing during your bathroom time. Day 6. Repeat the parts that felt best. Notice your morning energy and bloating. Tweak portions as needed. Day 7. Check in with yourself. What worked, what didn't. Commit to 2 or 3 habits you'll keep. Next week, a few honorable mentions if you want extra options. Kiwi fruit. 2 green kiwis per day have been shown to improve stool frequency and comfort in adults. Ground flaxseed. 1 to 2 tablespoons daily. Stirred into oatmeal or yogurt. Can help a lot. Drink water with its psyllium husk. A teaspoon to a tablespoon in water can be a gentle, effective, soluble fiber. Increase slowly and sip more water. What about foods that make things worse? Very low fiber foods like processed snacks. Lots of cheese and white bread slow things down. Large servings of red meat can slow motility. Very green bananas can be binding. Ripe bananas are usually fine. Big meals late at night don't help your gut or your sleep. Try to finish dinner 3 hours before bed. Medication check. Some common medicines cause or worsen constipation. Examples include opioid pain pills, some antacids with calcium or aluminum, iron supplements, certain blood pressure medicines like verapamil, some allergy or sleep meds with antihistamines, and tricyclic antidepressants. If you think a medicine is part of the problem, do not stop it on your own. Ask your clinician or pharmacist about alternatives or supportive strategies. Pelvic floor. Note: if you feel like you can't fully empty, or you push a lot with little result, your pelvic floor may be tight or uncoordinated. Pelvic Fluorophysical therapy can be life-changing. Ask your clinician for a referral if this sounds like you. How do you know you're improving? Aim for Bristol stool chart types 3 to 4. Soft formed, easy to passless straining, less bloating, a more regular bathroom rhythm, more energy, and clearer thinking are common bonuses when your gut is happy. When to call your doctor? Don't wait. If you notice red flags, new constipation after age 50 without explanation, blood in the stool or black, tarry stools, unintentional weight loss, fever, or severe, persistent abdominal pain, iron deficiency, anemia, a family history of colon cancer or inflammatory, bowel disease, a sudden change in stool caliber pencil, thin for more than a few weeks, these need medical evaluation. Let's bring it back to simple steps you can take today. Pick one food from the 5 and add it today. Drink 1 extra glass of water with it. Walk 10 minutes after a meal. Sit on the toilet after breakfast with your feet elevated and your belly relaxed. That's your starter kit. You want a quick plan to copy. Morning warm beverage, rescue breakfast bowl. Short walk mid-morning. 3 prunes and a glass of water lunch. Add a fruit or veggie and aim for half your plate to be plants. Afternoon, half cup kefir or a yogurt with a spoon of soaked chia. Dinner, include a roasted sweet potato and a leafy green. Evening, gentle belly massage, wind down, and lights out. A few safety notes before we wrap. Increase fiber gradually and drink more water if you have kidney disease, diabetes, or on fluid or potassium limits. Tailor portions with your clinician. If you're immunocompromised, use pasteurized kefir and skip homemade ferments unless your care team approves. If oats bother you, try certified gluten-free varieties. If you're on warfarin, consistency in your diet is key. Let your care team know about new daily habits. You don't need to live with discomfort or depend on harsh laxatives. Your kitchen already holds powerful tools. Prunes, chia, oats, sweet potatoes, kefir, used consistently. They support your gut, your energy, your mood, even your immunity. If this helped, please tap like so more seniors can find it, subscribe, and hit the bell for more clear, practical health videos made for life after 60. Comment relief if you're trying the 7-day reset, and tell us which food you're starting with. Your story might be exactly what someone else needs to hear today. Remember, small changes, big results. You've got this. And we're here to support you one simple, natural step at a time.